Okay, welcome everybody. Thank you for joining us today. We have placement student Sherry Gregoire, and she's going to do a presentation on compassionate communities. So the floor is yours, Sherry, and yeah, we look forward to your presentation.
Okay. Thank you, Francine. So on behalf of Near North Palliative Care Network, we're going to do a presentation on compassionate communities. I like to start today with a quote by the Dalai Lama, and it's on compassion. So this is a wish to see others free from suffering. So what is a compassionate community? Pallium Canada's definition is a community members that respond to local needs and empower individuals to provide important physical, emotional, social, spiritual, and practical support to patients, families, and caregivers. They also define it as a compassionate community is about improving the quality of life for people with life-limiting illness and their families, and this is done by encouraging people to advocate and provide assistance and practical support within their community. The HCPO has a definition, and theirs is, it is a community of people who feel empowered to engage with and increase the understanding about the experiences of those living with a serious illness, dying, caregiving, and grieving. In Ontario, we have a compassionate community model. So in this model, it aims to deprofessionalize and medicalize the end-of-life care and return it to the community. It is the community that builds up the social capital that can be used when citizens come to the end of their life. Right now, family caregivers provide more than 80% of care that is needed by patients with this serious illness or a long-term condition, and they contribute $25 billion in unpaid labor to our healthcare system. So with Canada's aging population, the number of caregivers and the support needed from those caregivers is expected to increase. It's going to be more like a 90 to 10%. In compassionate communities, they widen the circle of caring and provide much needed support to patients and caregivers facing serious illness and death. So I extracted this from the HCPO site. So it shows us right now, out of the 10 possibilities, 8 of them are being fulfilled by the community. And the community has things like friends, the workplace, school, the neighbors, a faith community, book club, volunteering, or a running club. So in the healthcare that provides 20% right now, we have the hospitals, the emergency department, family doctors, the pharmacy, oncologists, nurses, paramedics, and social workers. And in this model, it provides for early detection of palliative care needs. It also addresses the unmet needs of people who fall through the cracks of regular systems because of either poverty, isolation, or other social determinants of health. And it also complements primary care, home care, and team-based models of care, such as those seen in the Ontario Health Teams. In compassionate communities, community members take an active role in caring for people, and this can be done by assisting people to live comfortably in their own homes, connecting people to supports, raising awareness about health, well-being, and end-of-life issues, and it can be done by developing the capacity of others by building supportive networks in the community. When we speak of community, community may be the people who live near each other in a city, town, or neighborhood. It may also be a group of people who have common interests, experiences, or goals, such as coworkers, members of a faith community, or even members of a book club, running group, or online group. Each community adopts its own approach to building more compassion in response to its needs. Members of a compassionate community recognize that these experiences are a part of everyone's journey through life and that they can happen at any time. They also recognize that care for one another at times of health crisis and grief is not a task solely for health and social services, but is everyone's responsibility. All members share a common vision, and that vision is that all Canadians with life-limiting illness and their caregivers, live well until the end of their life. Criteria for membership. The membership is open to any individual who is interested in learning more about compassionate communities. You could be interested in assisting with promotion and awareness of those compassionate communities. And are you considering beginning your own compassionate community initiative? It can also be open to anyone working in a structured organization that are participating in a compassionate community or a city initiative in Ontario. They could also be working on a compassionate community initiative that has begun community engagement and or identified as a project sponsor and or secured resources or funding. A compassionate community can start by simply providing support to individuals. They may be dealing with serious illness, death, grieving, or caregiving by doing things like walking their dog, preparing some meals. These simple acts can grow to encompass an action plan for better support within the community. The action plan may include hosting an advanced care planning workshop in schools and workplaces, or hosting events at museums or art galleries that raise awareness about the experiences of death, dying, caregiving, and grief. So what can a compassionate community do? A compassionate community can engage with local government institutions and organizations to create policies and practical guidance that support people dealing with serious illness, caregiving, death, and grieving. Community social capital is an often untapped yet readily available and renewable resource that can enhance formal healthcare system delivery. And this is done by addressing the social determinants of health and the practical and spiritual needs of individuals and families. They can also create opportunities to help normalize the conversation on illness and death. They can help celebrate people, events, and organizations that bring the compassionate community to life. And what is it that compassionate communities do? Through community partnerships, compassionate communities increase awareness and create social support networks around those with long-term illness or coping with grief and loss. Compassionate communities complement healthcare interventions by paying attention to prevention, detection, harm reduction, and early intervention. Compassionate communities provide a roadmap for care in neighborhoods, and they alter social environments to improve outcomes. A compassionate community celebrates diversity and is inclusive of all. I put another quote in there that true compassion means not only feeling another's pain, but also being moved to help relieve it. Some benefits of a compassionate community. So with a changing society and current healthcare models, the needs of many, and those especially in high-risk populations, are not being fully met. Compassionate communities help fill this void. At-risk populations include people with serious illness at the end of their life, the elderly, the disabled, people who are isolated and vulnerable, and caregivers. These groups benefit from whole person care that addresses their physical, mental, social, and spiritual needs. It focuses on quality of life, acknowledges mortality, and supports their caregivers. Such care, however, is not routinely, seamlessly, or continuously available through formal health services. The HPCO, which stands for Hospice Palliative Care in Ontario, has an Ontario Compassionate Community Strategy that is coordinated under a Communities of Practice framework. This framework allows individuals, groups, and organizations that are implementing a compassionate community program anywhere in Ontario to be more interconnected by having access to sharing knowledge and information. In the spirit of bringing greater clarity and consistency to conversations about palliative care in Canada, the HPCO framework set out 10 guiding principles. These principles developed in consultation with people living with life-limiting illness, caregivers, and other stakeholders, and are considered to be fundamental to the provision of high-quality palliative care in Canada. They should be considered and reflected in your program and policy design and delivery. So these 10 guiding principles, number 1 is palliative care is person and family centered. Number 2, death, dying, grief, and bereavement are part of life. Number 3, caregivers are both providers and recipients of care. Number 4, palliative care is integrated and holistic. And the 5th was access to palliative care is equitable. Number 6, palliative care recognizes and values the diversity of Canada and its peoples. Palliative care services are valued, understood, and adequately resourced. Palliative care is of high quality and evidence-based. Number 9, palliative care improves quality of life. And number 10, palliative care is a shared responsibility. Pallium Canada offers a free startup toolkit for individuals or groups that want to start their own compassionate community. They also offer other free resources and toolkits, and they are currently developing additional resources, guides, and programs. An example of this is the Sustainability Guide. And in this guide, the Compassionate Communities Sustainability Guide will build on the Compassionate Communities Startup Toolkit, and this is done by supporting initiatives through their next phase of development. So what can you do? If you are wanting to learn more about the Compassionate Communities Strategy and how you can get more involved, you may be interested in joining the Community of Practice General Membership. It is open to any individuals interested in considering working in a structured organization, participating in a compassionate community city initiative in Ontario. Because being a kind and compassionate person, this is the inner beauty that is a key factor to making a better world. Another quote by Dalai Lama. And that brings us to the end, and I'd like to thank you. And the reference I used.
Great presentation, Sherry. Thank you so much.
Thank you.
If anybody has any questions for Sherry, you can add it to the chat bar. So we'll give it a few minutes to see if anybody has any questions. Okay. Okay, perfect. So yeah, this was a very nice presentation. And again, thank you. And thank you everybody for joining her presentation and listening in. So I want to wish everybody a good day. Angela Welsh says thank you. And I hope everybody remains cool today. It's been really hot yesterday and today. So keep cool and have a great rest of the day. Thanks, everyone. Bye.